There's Joe.
Okay,
We're just getting started.
Oh, great.
you are rolling.
Okay.
Tape's rolling. I'll be right back.
Some prep chairs?
All right. Welcome everybody. Since it's a small group, we can introduce ourselves. My name's Jake Felice. I'm a naturopath, and I have a clinic in Seattle and Capitol Hill, and I also work in Woodinville at Cascadia Natural Health. And my focus, my personal professional focus, is chronic pain. I do have a psychology degree from Penn State University, which was mostly a behavioristic approach at that time. And what I studied at Penn State, which interested me most, was Japanese automobile assembly line processes in the late 80s, when they were perfecting human performance in work teams. And so there was some kind of pretty things that we think of as commonplace now, but it was pretty revolutionary at the time. So human performance interests me as well. There is very much a mind-body connection, both between physical pain and obviously one in terms of physical performance. I do recommend medical cannabis for patients based on Washington state law. If you have questions about the law, we're going to have a lot of Q&A today, but I'm just going to talk a little bit about cannabis for about 10 minutes to kind of stimulate and give you probably a little bit of a different perspective from, come on in, from what is usually in most mainstream literature and media. So please think about questions, and usually once the first question gets asked, things roll along pretty smoothly. One of the things that first attracted me to cannabis is how easily it was to get patients off of more potentially damaging pain medications. In terms of, I mentioned that I have a psychology degree, which was my main degree at Penn State. I don't, it is one of the areas that I feel is more difficult for me in terms of medicine, so I don't necessarily treat depression per se, but I do a lot with PTSD, so I have a lot more experience with PTSD and specifically in the use of cannabis. So if there's one word for that I would hope everybody got out of the talk tonight, it would be the word is cannabidiol, otherwise CBD. CBD, it's Charlie Brown David, stands for cannabidiol. It is of the same molecular family as the molecule THC. Has everybody in here heard of THC in relationship to cannabis? THC is the best known molecule in cannabis because it's the psychoactive component of cannabis, and in my opinion is, and also very substantiated in medical literature, is the THC is the chemical that is responsible for most of the negative side effects from cannabis, and with the exception of nausea and appetite stimulation, which it's very good for, has a whole host of other negatives, so that when I approach cannabis, I often am very much downplaying THC strains and enhancing other strains of other chemicals in the plant, the one that I mentioned first, CBD. CBD is a wonderful molecule because it is the best pain reliever of all of the compounds in cannabis. It is anxiolytic, which means it reduces anxiety. THC actually can cause or create anxiety in certain patients. CBD opposes that. And this is not, the concept of two different chemicals in the same plant is not foreign to nature. For example, green tea, which is classically thought of as very health promoting, obviously has caffeine in it. But what makes green tea different than coffee is that green tea has another chemical in it called L-theanine, which counteracts the negative aspects of caffeine, such as the jitteriness and other issues. So it's a common concept. Patients who use cannabis that are high in CBD they don't have the short-term memory loss that is associated with cannabis. They have, in general, much better pain relief. And I did bring a PowerPoint presentation today that has all the peer-reviewed literature, and I will either be posting that because I think it's probably a little too big to send out in an email, but I'll try and shrink it down, or maybe Joe is pretty good with that, so we can get that into a format that you guys can use and can examine. So I just want to put that piece out, and I'm going to show you. It's going to be too small to see on the screen, but I'm going to just show you something very briefly, which is a little pie chart. This is on the presentation. You see the multicolored wheel here. There are over 70 cannabinoid molecules that the cannabis plant produces. The blue on top is the CBD, and each of the arrows are a biochemical pathway and or a physiologic effect. CBD has anti-inflammatory properties. It has anti-psoriatic properties, which means that it helps fight psoriasis. It helps THC be a better antiemetic, so it helps THC further prevent nausea. It is there. If you go home and Google it, there are tremendous now, a huge body of animal and cell tissue studies on anti-cancer proliferative effects. Very few human studies, but very many animal studies, and there's a political reason for that, which we can chat about a bit. It's also anti-spasmodic, so any of my MS patients, I want to make sure that multiple sclerosis patients, I want to make sure that they have CBDs in their medicine. It is a neuroprotective, and there are very good studies showing how it prevents against glutamate toxicity, and is also antipsychotic. So one of the main issues with cannabis is that it can produce or push certain predisposed patients towards a psychosis, unless the medicine has CBD in it, and then it's actually it has antipsychotic effects. So that's, I think, the main first point, and I think that probably what I like to do is open the floor up to questions and then kind of weave in the information that I want to share for you guys. So does anyone have any questions? And we'll pause comfortably.
How long are the effects of it?
How long are the effects of, good question. So the effects of cannabis as a medicine depend on the route of administration. And there are a couple major routes of administration. The first is inhalation, and by inhalation, most people think of smoking. I rarely recommend smoking to my patients. In fact, most of the time I recommend for them not to smoke because the cannabis smoke has potential carcinogens in the smoke, and we also know that it can predispose to laryngeal problems, so problems with the throat, and also chronic bronchitis. You can inhale a steam of cannabis. It's called a vaporizer, and a vaporizer does not have the products of combustion, and the duration of action of the psychoactive and pain effects for most people is about 2 hours on the low end, and usually 2 to 4 hours. Some people will get up to 6 hours with that. When cannabis is taken internally as in an edible or as eaten, instead of being directly absorbed, which it is when it's inhaled, it goes to the liver first, and it's called first pass metabolism. It's a very important thing that the liver does. The liver performs a chemical action on the cannabis molecules, and it does two things. It increases the half-life of the molecule, so that it means that the duration of activity lasts longer, and it also makes it much more psychoactive. So anywhere from 6 to 16 hours, depending on the dose, and for patients or recreational users who have eaten far too much cannabis, it can be over a 24-hour period, and most psychotic episodes that are induced by cannabis are induced by large doses of the edibles for that very reason. And I want to also make as a note, no human has ever died from an overdose of cannabis ever in the history of all the medical literature, despite literally billions and billions and billions of uses. There is a third type of delivery method that is an oral mucosal method. Oral mucosa, the cheeks, and have you ever seen people who have heart issues take a nitrous tablet under the tongue? That's also absorbed directly. There is a cannabis formulation called a tincture. Any herbalists in the room here? Okay, a tincture is a liquid extract of cannabis. The tincture can be used two different ways. One is it can be put in the mouth and swished around like you were to do a mouthwash. And when you do that, I usually have patients do that for about 2 minutes. And it also will have a rapid absorption, and then if the patients would like a mouthwash, spit it out into the sink. That again usually lasts from 2 to 6 hours. However, if they were to swallow it, then they would get both the first rapid effect and then they would get a slower effect. So that's usually a very good method for patients who have epileptic seizures or patients with migraines who need, if somebody has a migraine and they need to nip it in the bud. Most oral migraine medication usually takes about 40 minutes to kick in. With this particular use of cannabis, you can get the effect literally in minutes into the body, so it offers certain advantages as well. To recap, vaporized and oral mucosal usually about 2 to 4 hours, and edibles usually 6 to 16. So what do you think we give a cancer patient with severe pain who wants to sleep through the night?
Edibles?
We give them edibles. We give them edibles or a tincture that they would then swallow because of the length of duration. Good. Okay, good question. Any other questions? Yes?
So if you were gonna prescribe someone, you could prescribe them with the THC or without?
Good question. Good question. So how to even know what's in, because when you go to your local drug dealer on the corner, what is it that you're getting and what is it that you're not getting, and how do patients know what they're getting? So first of all, does everybody know that cannabis, when I say the word wild type cannabis, that means cannabis as it grows in nature. It has another word called ditchweed. It's an indigenous plant all over the world. Wild type cannabis, before it was cultivated by humans, has next to no THC in it. Street cannabis has almost entirely, the cannabinoid fraction is almost entirely THC. So what humans have done, and I think it's a good thing medicinally, I don't think the street drug is a good thing, but has taken a plant which in a wild type environment has almost 0% THC in the cannabinoid fraction, and created an organism that has almost 100%, not 100% THC, but almost all of the cannabinoid content is THC. So the plant has an amazing variability in terms of the numbers of effects that it can have physiologically. For example, we all know and love dogs, or most of us know and love dogs, and there are many different kinds of dogs. There are more types of cannabis than there are types of dogs. So, you've got huskies, which are good for pulling sleds, and poodles, which are not good for pulling sleds. Cannabis can have many effects, so different and particular strains can have different medical effects, and part of the patient education that is important for patients to get the best value out of and the best results out of their medicine and minimize side effects is the ability to know how to choose a good strain. There are laboratory methods that are now available, and many dispensaries or cannabis cooperatives where patients get their medicine from are testing for these levels right now. And the two most important ones are THC, which most of us know, CBD, which is the one that I hope you get from my talk today, and then there are a whole host of others. And it depends on what particular medical effect that we're going for. For example, there's another one, CBG. CBG is very good to help people sleep. It's very good for sleep. There is cannabichromene, CBC, is a dopamine uptake inhibitor, so it raises the levels of dopamine in the brain. Very good for depressed patients or patients that potentially suffer from depression. So there's a lot to it, and laboratory testing helps, and also if you know the genetics of the plant, the determination of which cannabinoids the plant makes is determined mostly by the genetics and also partially by the growing environment.
I can make one comment related to that.
Oh, yes.
THC being sort of, or CBD and all the other stuff he was talking about has been bred out of the plant on the black market, right? Because that's what the black market wanted. And in the medical community, there's a big push and a big rush to try to find the strains that have the CBD and breed them back into the plant.
And current published data that I've seen, 1 in 50 strains of cannabis has CBD in it, so 49 out of 50 strains don't. And I have had discussions with people who have done quite a large number of tests with thin layer chromatography, and their opinion was it's more like 1 in 700. So really there has a lot of the medicinal pieces have been bred out of the plant, and now what's kind of happening is a cannabis renaissance, at least in Washington, and the beneficiaries are the patients who are now able to, instead of rolling the dice on street cannabis, are able to get good quality medicine. Yes.
I have kind of a little case study.
Oh yeah, okay.
Is that good? I have a 60-year-old client with both rheumatoid and osteoarthritis.
Okay.
And various other kind of pain issues that I'm a little unclear about. She just had a surgery. And she has, I can't remember which type, but she also has hepatitis.
Okay.
A history of some sort of pain pill addiction. I'm
Okay.
not sure exactly which type.
I'm trying to keep all the points in order here. Okay,
As well as
alcoholism.
She has been in recovery for 2 years
Okay.
and is very active in both AA and NA.
Mm-hmm.
But I've had this in the back of my mind for a while.
Yes.
I mean, I don't think I would even bring it up probably soon, but she got me thinking about kind of the layers of
That is a
stigma.
great. Well, that is a great question, and it goes really to the heart of what a lot of cannabis and mental health is about. Usually when someone is in recovery and has been for a certain length of time, definitely over a year, and they are actively engaged in that process, whether that be through 12-step or any other number, they're usually pretty aware of what their triggers are. And so I have definitely seen patients who say, no, cannabis not for me because my favorite drug was more. And that would be a trigger for me. However, I also do have a large number of opiate addicts and alcoholics and combination of opiate and alcohol addicts who are safely and successfully using cannabis to treat various conditions. What is very clear in the literature is that in terms of opiate drugs, patients who use cannabis use fewer opiate drugs. It's no longer even really disputed, and it's definitely not disputed that cannabis is effective for pain. So I always try to inform my patients that cannabis is not safe, but of all of the analgesics, of all of the pain-relieving medication, it is the safest. It is safer than Tylenol. It is safer than ibuprofen, and it's definitely safer than Percocet and OxyContin. Opiates in Washington kill more people than car accidents, than automobile accidents, and we have in the United States have a tripling of the number of opiate-related deaths since the late 90s, tripling. And a lot of that is because, and I find it sometimes, and I get angry sometimes, that physicians say, oh, well, cannabis can predispose people to opiate use. I think in certain populations, yes, but for the majority of patients, it decreases their use of opiates. Did you mention one other drug class that they were using? No, okay.
No.
Hepatitis C, let's talk about hepatitis C.
That was the, yeah.
Hepatitis C, cannabis in Washington State, hepatitis C is on the list, so hepatitis C patients can receive benefits. We talked about CBD. CBD is wonderfully it protects the liver. There are any number of good studies showing even in teen users who are heavy users of alcohol, their livers are in much better shape than teen users who do not use cannabis. Oh, you mentioned alcohol. So alcohol. Cannabis reduces alcohol use, and most recently, and I tweeted on this I think a few days ago, there was a study on where they looked at in states where cannabis was legal for adult users, cannabis use, and I want to be very clear, I'm not recommending people smoke cannabis and drive, but this is just an indication of how cannabis prevents people from using alcohol. Cannabis use decreases death by alcohol-related fatalities by 9%. And the reason is because patients don't drink as much. Patients who are using cannabis, they just don't, on average, not in particular one patient, but on average, they don't particularly use as much alcohol. Many IV drug users have contracted hepatitis C. There is a therapy that cures about half of all patients with hepatitis C. It is a very difficult regimen to go through. It usually lasts about 12 months. The patients have to do self-injections, and many of the patients drop out before they finish their 12-month because of side effects. And cannabis can help patients stay in their interferon therapy and get good side effect control. And you're still rolling the dice. It's still a 50% chance. For example, one of the major side effects of the medication is patients develop serious and intense burning pains, which can happen anywhere in their body, most frequently in the skin. And topical cannabis, cannabis that is applied to the skin, is very good for that. Topical cannabis is good for certain types of arthritis, particularly of the hands and feet. It does a decent job on the knees. It does a poor job on the hips. I wouldn't say poor job, but not as good a job on the hips. And the benefit of a topical cannabis is you're still getting the extremely low toxicity profile, but most patients do not get a head high from cannabis. So they can effectively have a degree of pain control and not have to worry about a head high that's impairing them at work. Rheumatoid arthritis is an autoimmune condition. CBD reverses autoimmune processes a lot of the time. Most autoimmune processes are in a similar category to rheumatoid arthritis. There are a few others like scleroderma that are in an opposite effect, and cannabis can actually exacerbate. But for most autoimmune conditions, the immune profile of cannabis is effective. And let me talk about that. Sometimes the immune profile of cannabis. Cannabis can predispose patients to bacterial infections. So we especially worry about that in patients who are susceptible to bacterial infections, diabetics and HIV/AIDS, and with HIV/AIDS, particularly lung infections, pneumonia. That's a downside of cannabis on the immune system, but the immune system surveillance usually points towards attacking bacteria, or it points towards cancer, viruses, and autoimmune. And what cancer does is it changes the surveillance of the immune system away from bacterial infections towards an anti-cancer, anti-autoimmune disease, and an antiviral perspective.
What are so I'm writing down as you name them, what exactly you use cannabis to treat.
Mm-hmm.
I have hepatitis C, of course, and arthritis, the different types.
Multiple sclerosis, very effective. Migraine headache, it depends on whether you're talking about what's in the Washington law or what is
No, I want to know across the board.
Because the reason that cannabis affects so many different things is there is something called the endocannabinoid system. And it's rarely even studied in medical school, but it is an underlying system that is about 600 million years old in terms of evolution. And what the endocannabinoid system does is it helps the body deal with changes that are either external or internal. You're all familiar with cell receptors, what a cell receptor is. The number one most common cell receptor in the entire nervous system of all the cell receptors, including acetylcholine receptors, are cannabinoid receptors. They are the most common receptor in the nervous system. So if you think about it in terms of pure information, the nervous system is set up to receive the most amount of information through cannabinoid receptors, yet it's hardly studied at all in the in any conventional medical program. It's barely even mentioned. So because of that, it has a wide range of possibilities. In my opinion, any kind of pain, including moderate and severe pain, but also mild pain, can be helped with cannabis. Now, a lot of people frown on that, and certainly you can't do that in Washington. It has to be chronic, debilitating, and intractable pain. But in my opinion, especially topical cannabis, could really help the health of a lot of people. Why? Because it reduces dependence on more toxic alternatives that they're already using, such as ibuprofen or Tylenol. 50,000 emergency department visits a year from Tylenol normally consumed, not consumed in excess. Any issue where there's spasm. So migraine is a spasm of the blood vessels of the brain. Asthma is a spasm of the bronchi, of the tubes of the lungs. Any type of a smooth muscle spasm, so intestinal spasms in Crohn's disease, IBS, ulcerative colitis, it can be effective for. It's very good to protect the liver and hepatitis C. The drug companies are developing anti-cancer drugs based on cannabis molecules right now. It's effective in Lou Gehrig's disease, ALS, because at the end stages of Lou Gehrig's disease, patients lose their ability to, the muscles of swallowing, lose their coordination. And what's one of the side effects of cannabis? Dry mouth equals less swallowing, very good. It's fabulous for neurodegenerative disorders. It's good for autoimmune disease, so lupus, rheumatoid arthritis. It's good for so many different things. So it's extremely versatile, and in my also very political opinion, I think why there is a pharmaceutical bias against it, and I'm happy to talk on any or all of those points and share those with you, but that's my strong opinion.
So with a client like Karina's, who has, you know, a variety, it sounds like, of symptoms that could be useful or that can be useful for, and also perhaps like depression, with the intersection, I mean, you talked a little bit about psychosis and also the antipsychotic of CBD, and but I'm wondering, you know, with something like depression or...
Depression, I feel depression is difficult. Depression, I feel, is always difficult. It can be miraculously easy, and it can also be very, very difficult. So I think that it depends on the patients. What I would want to know if I had a patient that is, do they have they used cannabis in the past, and do they feel that it led to more compulsive behavior in and around drugs or alcohol, because that would not be a good thing. In terms of depression, there are certain strains of cannabis that can definitely aggravate, and THC, high THC strains can definitely aggravate. So in a perfect world, I have a few therapists that I refer to and really very much love and enjoy having conversation. I feel very safe if somebody is being regularly followed. I also will do suicide assessments, and I very regularly and am becoming very comfortable with PTSD-associated depression and suicide, becoming very comfortable. And I see a lot of Iraq war vets and Vietnam war vets for that matter, but I see them because the population is a little younger. And the VA, by the way, is very open to cannabis now because all of the soldiers, not all, so many soldiers are using cannabis to treat PTSD. One of the things that cannabis does a very good job of is it helps patients forget or de-emphasize or desensitize them to painful memories. So it's very good at that. So if the depression is associated with a history of traumatic events, I think that it poses a particularly good promise. But again, human beings and the human psyche is very much beyond the realm of a lot of science that's going on, and some people are much easier to treat than others. Did that kind of answer to your question?
Thank you.
And for pain, the one patient that I'm thinking of in particular has hepatitis C of mine. He is a Vietnam War vet with chronic pain, and he went and underwent interferon therapy to try to eliminate his hepatitis C, and developed something that's called a cryoglobulinemia, which causes intense burning on the soles of his feet, and he works on his feet all day long. We don't have him smoking cannabis, we don't have him eating cannabis, we have him using topical only. It doesn't give him a head high, and so he doesn't have a trigger, and it's helped him get off of his methadone. So.
I'm wondering about the ancient strains
Yes.
which have been bred out.
Yes.
Oh my goodness.
Yes.
I'm wondering when they started to be bred out and how they're found again.
Well, I think Brent can talk a little bit
I got an
to that,
opinion
but
on that.
Let me say one thing first of all, is that two things. One is that new strains are being created all the time in the crucible of the medical growing industry, and that there are a lot of beautiful new combinatory genetics happening. Number two, and it's in my PowerPoint presentation, I pulled an abstract from the Journal of Experimental Botany where 2,700 years ago there was a burial of a cannabis shaman, and he was buried with, amongst other things, a harp and a bow and arrow and a satchel of cannabis. And they did phytochemical analysis on the cannabis, and they found that it was very high in THC and very low in other cannabinoids. And the authors of the paper speculated that this was either used for medicinal purposes or for purposes of divination. And my personal opinion is that it must have been for divination, because had it not been, and this is 2,700 years ago, And they were all female flowers with no seeds, which means that the males and females had been separated and that they had obviously, there had been a selective breeding process going on. Most of the beneficial chemicals have been bred out because the good molecules, and I shouldn't say good, but the therapeutically beneficial molecules like CBD do to a degree prevent the head high. They prevent the head high. So if you're looking for a street drug, you don't want CBDs. It's just not. And Brent, you can talk to. Brent is a good knowledge of genetics and plant breeding, which is an area where I'm weak.
A little bit.
Yes.
Learning. Yeah, so, I mean, like Dr. Felice said, probably it's been cultivated for thousands of years in that way, manipulated, right, by humans breeding, but no different than, people get scared by that word breeding. I mean, you can't equate growing or breeding marijuana to like cooking up meth in a meth lab. You know, it's totally different. Even brewing beer is, you know, a manufacturing process where you're changing the chemical, right? With cannabis, it's more like growing tomatoes, right? Taking the optimum of what you find and crossbreeding them. But, you know, so humans have probably been breeding it and manipulating it since they found it, but as of probably, well, starting in 1937, but more so in like 1980, when basically worldwide, even in Europe, in England and the United States, cannabis went indoor growing with horticulture, right? Because in the past, the cops would go looking for big fields in you know, I would think in the 70s, probably most of the marijuana coming into the United States was shipped in over the borders, right? Grown wild, harvested wild. When they tightened enforcement on the border during the 80s through the 80s and 90s, you had a whole industry grow up of indoor growing in the United States. And so now probably about 80% of the product is grown within the United States. But the politicians still go out there and, oh, they're shipping it in. It's like, oh my God, could you be more clueless, right? About like what's going on in the world. But so probably in the 80s and 90s, when people brought them all indoors and picked their favorite strains, right, that they got from worldwide, and then started crossbreeding all those, you increased the, you know, hey, let's get a lot of THC, and you know, I don't think no one was conscious of it, right? They're just like, ooh, I smoked that one, I like that, right? And the end result was it was just a high THC content.
Thank you. And in terms of the economics of cannabis, and I have the citation in my PowerPoint, cannabis is the #1 cash crop in the U.S., more than corn, more than wheat, that cannabis is, and that there is more cannabis dollar production than we produce wheat, and there's a huge potential for tax revenue there. All of the dispensaries in Seattle that I send my patients to and cooperatives, they all have business licenses, they're registered with the city, they're registered with the state. I feel that the degree of professionalism is still very variable, but there are, it is a very exciting and rapidly changing field, because even a year ago with my patients were having a lot of trouble finding CBDs. And now they're finding it a much easier time to find CBD medicine, and I think that is a phenomenal thing. There have been the loss of some strains that will never have those genetics, and one of the strains that is used in the drug called Sativex, there's a drug called Sativex. It's not in the U.S., but in Canada and England and many European countries, it's an MS drug. The plant, and I'm pretty sure that it's the one that's used in Sativex, was rescued from the federal laboratory in Mississippi, and somebody took a cutting of it. I forget which strain that is, but that has now proliferated. So the genetics of new strains and old strains, I think, is a very interesting story. Unfortunately, it's not an area that I know a huge amount about. So,
a question about ethics. So, I'm a therapist, I have fibromyalgia. So how would that look if I wanted to use cannabis and still go to work?
Well, I would never recommend that you be under the intoxicating influence of cannabis while seeing a patient. Some other people will disagree with that. I think that cannabis has a place in terms of whether you call it spiritual or psychic exploratory. but that's not for everybody. In terms specifically of fibromyalgia, one thing very common across over 90, I believe it's 95% plus of fibromyalgia patients have sleep disturbance. It's very good for that. It's very good for that. If you have fibromyalgia, there are commonly aches and pains. The topicals are also very good for that. They're even really good for minor pains. So when I first really discovered this, my patients taught me. I would have hepatitis patients who were saying they were getting relief from their minor neck pain with cannabis oil, and it kind of clued me in, oh, there are other uses to this. There is in conventional Western therapy the kind of objective separation between patients, and I think that there are a lot of important issues with that. But it's usually not appropriate in a therapeutic setting to ask personal questions about your therapist. So was it more in relation to what patients would think, or what you think about yourself as a therapist?
Well, I guess I don't know fully what the impact is on my body, right? Because
Mm-hmm.
I've never used it. So I didn't know, because I heard you saying that some applications you don't get a high from it.
Mm-hmm.
And then I heard the topical application, because I don't want to be,
You don't want to be sedated
I
or
don't want anything, I don't take any kind of,
Mhm.
I don't do any
Okay.
kind of pain management other than my magnetic blanket.
Oh, okay.
So I don't do anything because I don't want to be under any kind of influence. I sit in the pain, and I do other forms of like massage therapy, trigger point
Acupuncture.
therapy.
Oh,
No,
trigger point,
I
okay.
haven't done- No,
Okay.
that was a bad experience, so,
Okay.
yeah.
Okay.
So I guess I just wasn't sure.
Oh, okay. So I would say, just without being able to make specific medical recommendations, it sounds like you might be a good candidate for topicals. However, you would not want to use it in any other way. And I think also for pain, there are very good mind-body approaches: Tai Chi, meditation, yoga, Qigong, etc. And all of them tend to work well with cannabis. The other thing that works well with cannabis, and including a topical, that some people would consider natural, is cannabis meshes very well with caffeine. So if you are in a daytime state, you can use a green tea in conjunction, or could, and didn't want a psychoactive effect, you could use a green tea in conjunction with a topical cannabis. Would give you a better effect than just utilizing the cannabis cream alone.
A topical green?
No, a nice cup of tea.
Oh, just a cup of tea, okay. I've had green tea and never did that much for me.
Oh, yes, it works with the analgesic part of the cannabis to enhance it. Yeah. Which is why they put it in Excedrin migraine. That's why Excedrin migraine has caffeine, there's a synergistic effect with caffeine and certain other pain relievers. But cannabis is very much a psychoactive plant. It affects the mind. It affects the mind for different people in different ways. Many, and I think most patients, it affects it in a positive way, but there are definitely patients who should not be using it. And there is also the gray zone where people can be using it under supervision. And in my perfect world, I would love to be working regularly with a therapist who understands cannabis therapeutics, and have them working on the mental, emotional, psychic piece, and then just in a conventional referral base, because then I really feel that they're better taken care of.
Gotta run.
Okay, it was good to be here.
Thank you so much.
Yes.
Yeah.
We'll post the rest of this. Shall we wrap things up, or does anyone have any other questions?
Well, I have one.
Okay.
I was wondering about the arthritis piece. Maybe if there's a little bit more tissue breakdown and problems. I was wondering how deeply the topicals penetrate.
That's why it's not so good on the hips. So with knees, very good for medial meniscus or medial pain. Somewhat good for arthritis that is under the patella, so that's called a Chondromalacia Patella. When it's deep inside, I do have patients get a pain relief. All of the receptors of this on the skin that innervate a joint work in conjunction with pain pathways, so that even if the pain is deep, I have patients applying all the way around the knee joint, and it does bring some relief, but it's not, there is a direct topical effect, and there is also, we know that there's an effect in the spinal cord as well, which is distal. So something is communicating from distal to proximal with the topical application, but for whatever reason, it is working in the and there's was one good paper on that. If you send me an email, I'll try and find it for you and can email you that. I find it very good for hand pain. It's really good for arthritis of the spine where there's associated muscle spasms. So a lot of people will have arthritis in the neck and have an associated tightness of the muscles, and also with the low back. Its best use is close to the surface, which would include any type of neuropathy, diabetic neuropathy, HIV neuropathy, any condition where there's intense burning pain on the skin, whether it's also good for sunburn, which is I guess a mild pain in general, but can be very good that way. Good studies also showing that topical cannabis helps work synergistically with opiate-based topicals, and will also help reduce the use by patients with those. Cannabis in kids, not a good idea, but what the studies show is that dispensaries opening in neighborhoods do not increase the use of cannabis with kids. And in fact, cannabis dispensaries for the most part are good neighbors, and the professional ones are in contact with police department, and they have surveillance equipment on the outside, the front, the back, and the side of their buildings. So they do a very good job of being good neighbors, or they can do a very good job of being good neighbors. And what studies in Oakland show is it actually decreases the crime in that area of the neighborhood rather than increase it. And that's on my Twitter feed as well, if you're interested in that. So.
Thank you for coming out.
Yes, thank you for having me. I really appreciate it. If you have any questions, you can email me. You can get my email through Joe. I like to have as much of a science-based approach as I can. So I'm happy to provide documentation, and I have a pretty large PowerPoint with all the references that I will.
Yeah. If you give that to me, I know there were a number of people, there's actually a lot that ended up being scheduled for tonight. So there were people that wanted to come,
and
weren't able to attend because they had other commitments.
Okay.
So if I can get that PowerPoint,
That's good, and we'll also edit the video too.
Okay, great. And so if you can send me a link to that, that'd be awesome, and then we can tap into that too.
Yeah. Okay. Have a good weekend. I know you're working tomorrow, or you're here tomorrow, but have a good weekend.
Yeah.
It was great information. I mean,
good.
It really was. Know about pot, but it was great.
It's not, you have hepatitis, go smoke a joint. That's not what it's about.
Yeah, it's a whole wonderful.
I'd be curious to see if we can't get maybe the faculty interested in bringing you
I was
in.
thinking that
I'd be happy to come talk with you again. I'm very happy to do that.
I'm working with a few faculty, and I may see if we can set up a meeting.
to tie in for like what we did today. I mean, it was a perfect segue.
Yeah.
We did chemical dependency today.
The cannabis dependency physiologically works through all the same brain pathways. So there is, it's really good if you have a spouse in the room. You can get a sense if it's, because it's tough sometimes to ask the patient, do you have a problem with cannabis?
Family always rats each other out.
What's that?
Oh, right. You're like, oh, no, I don't.
Especially couples.
Yes. So, and that is a big factor. So, yeah, thanks. Okay.
Thank you.
All right. Thanks for the video, Brent, too.